Hello and welcome to Interprepedia. If you're new here, my name is Rosa. I'm an interpreter, and for this video I have prepared a simultaneous interpretation practice similar to what you can expect to find in the CCHI oral exam. This was requested by a very dear colleague of mine and someone that I admire greatly. I have a few videos lined up that have specifically been requested by some of you, so stay tuned for those coming up soon. And if you have a special request, let me know in the comments, and if it's within my scope of expertise, I would love to make a video about it. So I've taken the CCHI oral exam 3 times. Yes, you heard it right, 3 times. Now, I did not have to take it 3 times because it's super hard or because I totally suck. There were many reasons for that, and if you want to know why, check out this video where I'll tell you the whole story. The CCHI oral exam has a simultaneous interpretation component, and for some of us, it can be intimidating. So hopefully after watching this video, you'll have a better idea about what to expect, and you'll be able to practice and do really well in that portion of the test. In this portion of the test, there are 2 segments. One to interpret from English into a foreign language, and one to interpret from a foreign language into English. Each segment is 2 minutes long, and I guesstimate that the speed should be about 120 words per minute. The segment where English is the source language most likely will be a healthcare provider speaking, so pay special attention to medical terms, of course, but also to any list of multiple items and special instructions. The segment where a foreign language is the source most likely will be a patient speaking and telling some kind of story about something that happened to them. So pay special attention to idiomatic and colloquial expressions, tone, emphasis, and repeat words. Since my working languages are English and Spanish, I have prepared the practices in these 2 languages. But even if your languages of expertise are different, you can still benefit from the English practice, and you can get ideas about how to create your own recording. If you want to refer back to these practices in the future, check out the timestamps in the comments so that you can skip right to this section. So here's what I recommend we do. Record yourself every time you practice to evaluate your performance. Look away from the screen, don't cheat, because I will display the transcript of the script. In the transcript, I have underlined words that I consider scoring units, so you can have a quantitative way to grade your performance based on how many of those you hit or miss. Normally, certification tests do not have scoring units in the first few seconds to give you that wiggle room to start, but this is just to give you an option to give yourself a score. You should also give yourself a subjective score based on how you sound overall. One important thing is to just keep going no matter what. If you don't know how to interpret a word, skip it and forget it as quickly as you can, otherwise you will end up missing more scoring units. The following segments are about 2 minutes long and have 240 words each. So if you want to practice with other recordings or create your own, try to find things within similar parameters. If you're struggling, you can use YouTube's settings to control the playback speed and reduce it to 75% or even lower, and then work your way up to the actual speed. Now let's get started.
Diabetes is a group of diseases that affect how your body processes glucose, which is also known as blood sugar. Millions of adults in the United States have prediabetes, a serious health condition in which glucose levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Over time, having too much glucose in your body can cause serious problems. It can damage your eyes, kidneys, and nerves. Diabetes can also lead to other serious complications, such as heart disease, stroke, and even the need to amputate a toe, foot, or leg. Some people are at higher risk of type 2 diabetes because they are overweight, are 45 years of age or older, have a close relative with type 2 diabetes, exercise less than 3 times a week, had gestational diabetes, or had a baby who weighed more than 9 pounds, or those who are from certain ethnic groups. There are blood tests that can show if you have diabetes. One type of test is the hemoglobin A1C, which measures your average blood glucose over the last 3 months. Doctors can also use the A1C to see how well you're managing your diabetes. A normal A1C level is below 5.7%. Pre-diabetes is between 5.7 to 6.4%. Type 2 diabetes is above 6.5%. If you have diabetes, you should have the A1C test at least twice a year. Yo estaba caminando por la calle y de repente me caí y me torcí el tobillo. Iba caminando muy deprisa porque iba a llegar tarde al trabajo. Mi hijo me llamó a mi celular porque se le había olvidado la mochila de la escuela en la casa y no sabía qué hacer. Estaba muy ofuscada y no me fijé que había un hueco en la acera y de repente ¡pum! Me caí y todo lo que llevaba en las manos salió volando. Mi celular, la sombrilla, la lonchera con mi comida para el trabajo, hasta las monedas que traía en mi billetera salieron rodando. Ay, doctora, me duele mucho, mucho. No puedo apoyar el pie y se está hinchando y poniéndose morado. Afortunadamente, un buen samaritano se detuvo al verme llorando tirada en el piso y me preguntó qué me pasaba. Cuando le conté que me había caído, se ofreció a darme un aventón hasta el hospital. Yo no quería venir porque no tengo seguro, pero el dolor era tan grande que no podía ni caminar y no sabía qué hacer. Ayúdeme. Yo soy madre soltera y tengo que ponerme bien para poder trabajar y mantener a mis hijos. Esto es lo último que me faltaba. En mi trabajo me necesitan y no puedo faltar. Doctora, dígame que no hará falta ponerme un yeso ni hacerme una cirugía. Por favor, doctora, ¿me voy a poner bien?
Well, how did you do? I hope you had a good practice, and if you are getting ready to take the test, I wish you the best. And for now, thank you so much for watching. Adios.